Thanks everyone for joining us. I'm Ash Clarke, Director of Research Operations here at Grampians Health. It's fantastic to have you here for the first official session for our Grampians Health Research and Innovation on the Run. Before I introduce the speakers, I'd like to acknowledge the traditional owners of the unceded lands on which we're meeting. So for myself today, it's Wallarong country, and paying my respects to elders. We've actually unfortunately had one of our presenters unavailable at short notice today, so that's Allison Monk's Aboriginal Health Innovation Project. So what we're hoping to do though is slot her project into a later session, so just watch the space in terms of agenda changes. What that does mean, however, is with two presenters, we'll have plenty of time for questions today. So we'll do one each presentation, and then we'll have time for questions. Throw them in the chat, or even better, if you want to unmute and put your camera on and ask them in person, it would be great. As you can see, we are recording today's session as well, just because we use it for staff that are unable to attend today and in person. So we'll have those recordings available in a couple of weeks' time. I'm going to introduce, however, our first presenters. We've got Laura Hartmann and Rosie Eyre, and it was pretty novel and also exciting that the first registration for this event, an abstract submitted, came from our legal counsel, which I've never had happen before, and I'm super excited to introduce the team. So the topic of their presentation is Creating Gladys, How Legal Design Can Support Person-Centred Care in Public Health. Thanks, Laura and Rosie.
Unmute. Thanks very much, Ash, and thanks everyone for having us. I know we're probably a little bit left of field when people think about research in the healthcare setting, and I hope that today you'll find this topic interesting and slightly a different take about how law and the practice of law can intersect and impact on consumer care in a public health setting. I'd like to also introduce my co-presenter, Dr. Rosie Eyre. Rosie is she's a rehabilitation consultant, and she's also our current RACMA fellow. And Rosie was part of the team on this project. Rosie's recently taken out the Victorian Mary Tobin Prize for her presentation on this topic as well, and presenting our research, and she's recently represented Victoria at the national final, where she did really, really well. So thanks for your time today as well, Rosie. So what's this project all about, and what on earth is a lawyer doing up speaking during a research presentation? So really to set the scene, really the backbone for this project is an emerging field of practice called legal design. And in our context, really that requires us to move away from a more traditional approach to law and legal practice. Oh, sorry, I've got a couple unmuted. Does everyone just mind muting? I've just got a bit of a feedback on the line there. And in our context, we're really looking at how the practice of law actually can have a flow-on effect through to patient care, and recognising that law and legal processes within health systems fall into the health literacy environment, and the way that the law interacts with consumers does have a bearing on their ability to participate in their care. Our project really targeted health literacy, and as I don't need to tell anyone here, health literacy ACSQA recognises as a really integral enabler of person-centred care. The legal processes that arise in a public health service are part of the health literacy environment. And most often, although they underpin everything we do, most often consumers don't interface directly with the law. So the law governs everything we do. So it underpins all of our policies, all of our procedures, all of our processes, everything from the law governing how we buy things, like research devices, through to the way that we treat mental health patients under the Mental Health Act. While there's an undercurrent, it's actually very rare for a consumer to really interface directly with law in a legal process, such as the case study in the Gladys project. Why it can be really problematic is that traditional approaches to law tend to focus on, as a world-leading legal designer, Stefania Passera says, law tends to focus on the essence and the precision of rules, but not necessarily on the needs and the abilities of the individual tasked with understanding and acting upon such rules. And so really, this is why lawyers like myself, we get such a bad rap, because we're known as being very pedantic, totally incomprehensible. Our written work is mystifying. And you can see that that doesn't necessarily align with the person-centred care paradigm or with health literacy, because when there's a direct interface, that can really impact on a person's ability to gain the information that they need to participate meaningfully in their healthcare. So there's real tension between legal practices in health and the person-centred care paradigm. And there's obvious barriers arise to health literacy when consumers are interacting with those very wordy, very legalistic processes within health. So our case study today, it's called the Gladys Project. You might have heard of it. If you've spoken to me anytime in the last 18 months, you will have definitely heard of it, because I haven't stopped talking about it. But really, this arises around a piece of legislation in Victoria that we have, which is known as the Freedom of Information Act. Under the Freedom of Information Act, members of the public hold a right to access any government documents or any documents held by Victoria public sector agencies. And in Victoria, that's actually the main way by which consumers of mental health services can access a full copy of their medical records. That's important for health literacy, because people, by accessing their medical records, it empowers them to participate in their care or to ask questions. And although people can obviously have health service to health service transfers, or can access information via their My Health record, sometimes, and for various reasons, people would like to have a full copy of their medical record. It might be to help them through a difficult time in their lives, such as seeking legal support. Some people are just curious, or it might be to support them through like a Transport Accident Commission claim or a work cover claim as well. And around 70% of all of the Freedom of Information applications in Victoria year on year are by members of the public seeking to access their own medical records. The FOI Act provides a really good legal framework by which to facilitate these requests. It allows us to have order and structure about the way that we process requests. And the way that all health services do it is by means of template letters, which is where this project sits. In order to comply with the Act, in order to comply with the huge number of professional standards which then are imposed on health services under that Act, most health services across Victoria just have a standard set of letters which they use. The other really important contextual piece of information is that across Victoria, for various reasons, Freedom of Information applications for health records are going through the roof. In 2021, 2022, Grampians Health received 893 applications, making it the 18th highest agency receiving requests in Victoria. In 2022 and 2023, we received 992 applications, making us the 15th of Victoria. And we know, although it hasn't been published yet, we actually processed around 1,200 to 1,300 applications last year. So the numbers are going up, and it is has posed a real administrative issue for hospitals, because there's little costs recovery or funding available to manage the rising number of applications. And so we for our project, we had a look at this issue. We didn't have any resourcing available to really hire people to address the rising number of applications that we were coming across. And so we used a legal design paradigm to start questioning, well, how else can we start to address freedom of information, and what could we do to really empower people through that process as well? So I'm going to get Rosie to talk you through how we set up the project and how we aligned it with our vision of values. So over to you, Rosie.
Thanks, Laura. So yes, we wanted to create a more efficient and sustainable FOI service, and we wanted this to align with our strategic priorities and values. Specifically, we wanted to partner with our communities through collaboration, enabling consumers to make informed decisions and support ownership of their health and wellbeing choices. We also wanted to embed innovation, including digital technologies, to meet our community needs. Next slide. Thanks, Laura. So in terms of our approach, we took a two-stranded approach using a legal design methodology, combining human-centered design, which is essentially person-centered care, behavioural science and legal practice, to create a more efficient, sustainable FOI service that aligned with our vision and values. This involved a multidisciplinary build team, creating new template letters through the Plain Language project and process automation. The new template letters were based on the existing letters and the OVIC templates and converted into a plain language accessible format. The three sets of letters, existing, OVIC and new, were analysed for readability. We also obtained qualitative feedback from our consumers about their experiences with the range of template FOI letters. The automated FOI solution is compliant with legislation and professional standards and was built using the Neota Logic digital platform. Although most of the process automation is organisation facing, the public interface has changed. This involved moving from a downloadable, handwritten and scanned form to an online automated intake portal with an email option for legislative compliance. The two strands were developed using a consumer persona called Gladys, which set the tone for all of our communications and were informed by the World Health Organization principles for effective communication. Next slide, thanks. Our consumer persona Gladys was created through demographic research of our people and our health. For context, I would like to provide some more information about our community and region. Our 250,000 residents are serviced by over 6,500 Grampians Health workers across a region spanning 48,500 kilometres squared. Many communities in our region experience socio-economic disadvantage and are more likely to suffer ill health, particularly chronic disease. Grampians Health is the largest employer in our region and our processes are embedded in our communities. Next slide, thanks. So I'd now like to introduce our consumer persona, Gladys. Gladys is a 69-year-old mum and nana who lives in Horsham and travels to Ballarat once a week to look after her 3 grandkids. During the week, she helps kids at the local primary school with their readers. Gladys's husband passed away from a chronic heart condition. She used to drive him to Ballarat for treatment every week. Gladys wants to be well informed about her health and her options for care. Next slide, thanks. So this World Health Organization framework was used to ensure that consumer interactions with the FOI service were accessible, actionable, credible and trusted, relevant, timely and understandable through the use of plain language, information design, which included the use of symbols, demographic research, the Gladys persona, user testing and process automation. I'll now hand back to Laura.
So to provide a baseline for our work, the first part of our analysis involved using 3 measures of readability to gauge where our current template letters sat and how we could improve. We used 3 really common measures of readability. If you haven't come across them before, they're called the Flesch Reading Ease, the Flesch Kincaid grade level, and the passive voice component. Flesch Reading Ease is on a scale from 0 to 100, a easily readable and consumable piece of writing. Generally has a Flesch Reading Ease of 70 or above. The Flesch Kincaid grade level, similar to Flesch Reading Ease, it's based on combinations of syllables and word counts within a sentence, but the Flesch Kincaid grade level expresses this in accordance with the American school grade system, and it provides a really good way to speak about the readability of a piece, because you can couch it in terms of what level the audience can read it at. Finally, passive voice component. Again, it's a good measure of readability, because a passive voice sentence, for those of you who haven't come across this expression before, is where the object of a sentence is used as the subject of the sentence. And just a really quick example of that is the letter was posted, or the letter was written, and you can hear in that sentence the first question you're asking is by whom? Who posted the letter? Who wrote the piece of paper? So that's it. Passive, when we use a very high component of passive voice, it makes it really difficult for readers to target and pinpoint the information in a sentence or in a piece of writing. We used two tools, Microsoft Word readability statistics and a program called Readable. Both of those measure the same statistics, but they measure them in slightly different ways. So we took both. We used both pieces of software to just provide a bit of a clarity and to get a slightly different benchline of where we were hitting because of the way the documents were structured. You can see here that we also focused on our acknowledgement letter, which is the first letter that a consumer receives when they make a Freedom of Information application. It sets out things to say that we've received it, that it's valid, and when you can expect us to respond by. That's the first communication that a user receives. The final communication that a consumer receives is the decision letter. And in that letter, Grampians Health tells the consumer what we've decided to do with the request that we have, with their request. We might decide to give them a complete release of their medical record. We might decide to have a partial release of their medical record, which is where we take certain information out because of its particular sensitivities and exemptions under the FOI Act, or in some very rare cases, we actually refuse to release the record at all. And so that decision letter, it's the last letter of the process, and those two letters bookend. So we thought that they were the most important letters to do the readability analysis on. Gone too far. So you can see, looking at this table, that the originals, the Grampians Health originals, were very difficult to read. Having a look at the Microsoft Word statistics, we can see that actually, I'll give you the breakdown here. The acknowledgement letter was difficult to fairly difficult to read, sitting at around a grade 8 to 12 reading level, which puts you somewhere between Harry Potter and A Brief History of Time. And around half the letter was of the acknowledgement letter was actually imprecise or unclear. The decision letter, rated at very difficult to fairly difficult to read, was written at a grade 8 to 14 reading level, and the scale actually stops at 14. So it was a really difficult letter to read and consume, and again, really high component of passive voice. So that we knew that when we redesigned the letters, we had a lot of work to do to raise the readability, so that our consumers could more easily access the information that we were trying to communicate to them. So through rewriting both letters, or all of the letters in an FOI series in plain English, we were able to achieve some really great readability outcomes. Our acknowledgement letter moved up to over 80 readability ease, and down to a grade level of 3 to 4, which means that pretty much it's a very simple, very accessible letter, and passive voice we got down to 0. Our decision letter, although the reading ease is still sitting below 70 and the grade level is between 6 to 8, there's probably a couple of nuances to that, in that we retained words such as Victorian Information Commissioner and a standard definition of personal information. And you can hear, just through me saying that those words already carry a really high syllable count and a really high word count. And so we think that the decision letter is actually quite easy to read, but it's those combinations of higher syllable count words that actually are keeping that reading ease a little bit lower. So once we'd redesigned our letter series, we wanted to actually check and speak with our consumers to understand how they experienced it. And for that, I'll hand over to Rosie to talk you through our user testing phase.
Thanks, Laura. So qualitative feedback was obtained from 8 consumers who were engaged via the Grampians Health Consumer Participation Program. Consumers were shown the original OVIC and redesign acknowledgement and decision letters, and consumers were asked a series of questions about their experiences with the range of template FOI letters. Next slide, thanks. So here is some consumer feedback for the original acknowledgement letters, and consumers found that the letters look a bit dense, not as easy to read, got a very negative tone, not really personalised, make the consumer feel frustrated and stuck in the system. Laura, I'll let you go on with the next slide.
Yeah, so we took the same approach with the decision letters. Consumers felt that our original decision letters weren't personal, they weren't tailored, that there was nothing in them to tell the consumer that we really felt or understood what they'd asked for. They felt we were very unofficial and unfriendly, that it was hard reading and very complex. It was wordy and political and too hard to take in, which is really quite important feedback on our original letters, because basically they showed us that across our range of consumers, they weren't taking away the information that they needed to about the decision that we had made. And that really goes to transparency as well, and how consumers engage and actually trust an organisation. If they feel it's not transparent, their trust in an organisation will be lower. We also tested specifically the consumer's recognition of their right to seek a review of Grampians Health's decision. This is a right that arises in law, wherein if we've taken some information out of a consumer's medical record, they actually have a right to go to the Office of the Victorian Information Commissioner and ask them to take another look at what we have decided. And so in our original letter, we asked consumers, what can you do if you're not happy about this decision? Our findings were that 5 out of the 8 users couldn't identify the OVIC, or that they had a deadline of 28 days in which to exercise their right for review. I'll note that two users we didn't get to ask the question because we ran out of time. Only one of our users correctly identified that they had a review right and that they had to make the request to the OVIC in writing. Although I just reflect that they did this by reading word for word back to us rather than answering in their own words, which might suggest that that our cognition reading on that isn't as clear as it could be. And it took users a really, really long time to search for that information within the letter. And some feedback we had from our consumers about this was, if you really want us to complain, we, Grampians Health, won't make it easy for you, but here's how. And just some other really powerful feedback. One consumer said, well, if I get a letter like that, I read the first page and I'm like, boom, that's it. Why would I even bother? So really quite devastating feedback, not only about cutting people off from their rights, but also about the way they saw Grampians Health through that. Just my slides are not moving on. And so here are some of the redesigns. We used tables to synthesize group information more clearly. We used large spaces of a lot more white space, so that it was really clear and communicated very, very succinctly everything a consumer would want or need to know about their freedom of information application. The user feedback was that the documents were pleasant to look at, very professional but friendly, a bit warmer, and one consumer remarked that they felt it was much more accessible to a large range of people. You can see this is an abstract from our decision letter. Again, we replicate the table at the start to set out the really clear information. In In testing, users found that this was a lot more collaborative. They reflected that they felt like Grampians Health was working through them. One consumer reflected like it really feels like the person who wrote this letter understands why I want the material and why I want to have it, and they're trying to help me. Consumers felt it was much more personalised and carried less jargon. Really interestingly, the words thorough and diligent, which we are required to put in by the OVIC, tested really badly with consumers, and ultimately we took that word out. Apologies, I'm just having a bit of trouble moving the slides on. These redesigns here again are from the decision letter. You can see we've used really simple Microsoft stock symbols to draw people's attention to the fact that they had only had 28 days to seek a review at the OVIC. That tested really well with consumers, and we found that everyone, again, 5 out of 8 were able to really quickly identify that they could seek a review, and they only had 28 days to do so. We've just shown you an extract there. When we take information out of a record, we have to explain to the consumer why we do so, and each of those is referable to a section of the FOI Act. And you can see a rewording on the screen here about how we did that for personal affairs information. And it was really interesting in the consumer feedback. Consumers were actually quite understanding, and when we explained why we'd taken out personal affairs information in plain language, consumers were a lot more receptive and understanding of it. One consumer reflected, I like that so much more than we can't give you this or we're not giving this. Isn't it funny that it reads so differently when you put it like that? And one consumer said, I actually feel happy because I know what I'm getting and the reason. So Rosie is going to talk now a little bit more about the outcomes and the impact of our project.
Thanks, Laura. So we use the user feedback as our prime means of gauging the impact of the redesigns. The feedback was more powerful than we had anticipated. Based on this, we engaged with the Office of the Victorian Information Commissioner, presenting our project and findings to a number of senior staff. We have been overwhelmed by the generosity of the OVIC in engaging with our project and its receptiveness to our work. Our work coincided with the OVIC's own review of its templates, and we have provided our work to the OVIC project team to support their redesigns. We have also made a set of debranded templates available under Creative Commons license for other public health services, and at present, 9 large Victorian public health services have obtained copies of the templates to use in their own FOI services. Grampians Health started using the redesigned template letters in October 2023, and the process automation system, which we affectionately know as Gladys, went live in July 2024. There have been approximately 300 FOI applications lodged using the process automation system in the first 2.5 months since going live, and this compares with approximately 215 FOI applications at the same time last year. Despite the increase in volume of applications, the composition of the team has not changed, suggesting that the process automation system may have assisted with some of the administrative burden associated with FOI requests. Next slide, please. So Grampians Health now has FOI template letters, which is simple to understand and accessible for a wide reading audience and align with our strategic priorities and values, specifically partnering with our community through collaboration. The use of plain language means that consumers can better understand our processes and their rights. The use of plain language and the Gladys persona has also successfully informed the build of the process automation system for FOI, which includes a public interface and aligns with our strategic priorities and values, specifically embedding innovation, including digital technologies, to meet our community needs. The new FOI template letters are also generated by the process automation system and emailed to the applicant. The process automation system is hoped to reduce the administrative burden associated with FOI requests, as well as improve consumer experience when making an FOI request. Thanks, Laura.
If you'd like to know more about this project, we have published a case study on the information design part 1 phase through the Legal Design Journal. You can access it via the link in the slides for free. It's under open access, Creative Commons. I can't remember what Ash said about questions, but if anyone does have any questions, we just thought we would actually run our little demonstration behind so that you can see it working. I'll just reopen it so that you can see Gladys in action.
Thanks, Laura and Rosie. While you're getting that up and running, if people can either throw questions in the chat or raise your hand. But here we go. Here's Gladys.
So this is the public interface that you're looking at. Yeah, Anna.
Hey, fantastic work. That is an amazing lot of work and just so responsive to the consumers. That is fantastic work, you guys. Congratulations. And super excited just, from the research point of view and how rigorous you guys were. That looks great. I am going to ask you one question around the consumer feedback that you had on the tool. And I'm going to make it hard because you did it. You've done such a great job. But I'm just wondering if you had an idea about what the health literacy levels were for those people that you asked to give you feedback. Or you had an indication.
Such a great question, Anna. I don't. It wasn't something that we tested. We deliberately went wide, and there were no exclusion criteria or inclusion criteria for the project, because we really just wanted to get a read on a really broad spectrum of the public. And so, while we didn't test the health literacy specifically, our consumer group was actually really, really broad. So we had mental health consumers, carers of mental health consumers, parents of children who have in care at Grampians Health, people with neurodiverse traits. So it was a really broad user group. I think it would be fascinating to take a baseline health literacy reading before you started and actually test that at the end. If we had our time again, that might be something that we did differently.
That would be like super extra icing on top for sure. I think how many consumers did you talk to?
We only got 8.
Okay, yeah.
So this was qual. It was all qual. We didn't. We don't profess to have that there's any statistical significance in the data that we got. We tried to get 10. And we tried to get 10 through our consumer partnership program. We weren't successful, and we ended up recruiting some via our lived experience workforce as well, and that got us to 8. So it would have been great to get 10, but that's where we went. And we're limited by budget and time as well, because this was on top of BAU.
It's an amazing amount of work. And I just wondering though too, as I was thinking about it, is maybe the people that are putting in FOIs are at a reasonable health literacy level anyway. I'm not sure, but you want to make it accessible for all levels of health literacy, of course. But I'm just wondering if you've got a specific cohort anyway. But yeah, fantastic job. I totally call that research.
Oh, thank you. I think there was another question, sorry, because I've got the tiny square. Oh, Donna, sorry.
Just wanted to know, with the workflow, did you write your own workflow, or was it a program that you used to do all of the back end stuff?
Yeah, great question, Donna, and thank you. This allows us to show off shamelessly. So thank you. Not a plant for everyone else listening. So actually we did something quite different here, and we opted to use low code legal automation software, which required us to build the automation from scratch. So it's not an off-the-shelf project. We used swim lane mapping to with our team, including our 2 FOI officers, Anna Glenn and Kristen Wilkinson. And we mapped out the whole process over about 6 sheets of butcher's paper on swim lanes. And to the credit of Neota Logic, we turned up at our first virtual meeting with these big sheets of butcher's paper, and we're like, this is what we wanted you to build. So Gladys is actually 36 automated workflows hung together in an interface. You've seen the public interface play just now, but behind that actually sits a really complex process automation. We're one of the more sophisticated users of the Neota Logic platform. And we are just about to enter phase 2, where we're going to hopefully produce a slightly less complex version that other health services can implement with a little bit more ease. But yeah, it's a really big build, and we did actually map it ourselves. So yeah, it was really different way to do it rather than buying an off-the-shelf product. We did actually evaluate off-the-shelf products before we went down this path. And the reason that we didn't go with there are some off-the-shelf products out there. The reason we didn't use that was because we wanted the ability to maintain it ourselves and not be dependent on our IT resourcing to make changes. The Neota interface actually allows us to make tweaks along the way and adapt and change things as we need to. So I know I'm tight for time, but really quick example was on our intake form, consumers can input. You have to pay an FOI fee of $32, but you can ask for that fee to be waived if you have a compassionate reason. And in our first version, we just put in compassionate reason. Are you seeking a fee waiver? And you had to choose compassionate reason. But we found that actually wasn't accessible language, and we had many consumers coming through and not including credit card details, or including like pretend credit card details because they couldn't pay the fee. We realized we had a problem with how we were expressing compassionate access, and it meant that we could go in ourselves and actually alter that screen to say, please select compassionate access if XYZ. So that's just it was a really beautiful thing about the flexibility of using low code.
Fantastic, Laura. Well done. I was just reflecting on one of your earlier slides where the original versions and the word count, and then in the revised versions, how much the word count went up, but the language gets simpler. It's that interesting paradigm, isn't it? Because you often think that the less words, the better. But in this instance, the simpler phrasing is actually a lot more readable and effective. So, yeah. But a very consumer-centered piece. So congratulations. That was fantastic. Well done. Well done.
Thanks.
So moving on to our second and final project presentation for today. So we've got Carmel O'Kane from the Wimmera Cancer Centre and Donna Bridge from the GICS team presenting their project on sharing the digital love in cancer supportive care. Thank you.
Okay, can everyone see that up on the screen?
Sure can, that's great, thanks.
Excellent. So a little bit of work from the Wimmera. Carmel and I and the cancer team here just did a little project pretty much, which was to, now I've done this, next slide. Let's try that. Okay, so to use some technology and some electronic forms and the electronic medical record to deliver quality supportive care for cancer patients. So every patient that comes to the Wimmera Cancer Centre is given the option of some supportive care, and they undertake a screening for that patient. So instead of a paper-based form that patients filled out themselves or with the help of the nurse, they are now entered directly into a tablet. So the nurse will sit there with the patient and actually go through all of the screening questions and capture the data directly, and it goes straight into the electronic medical record. any needs are identified and discussed with the patient. And then the referrals are made that connect the patient to the services they need. From that electronic screening tool, an MDM report is automatically created. So there's 2 different forms in Opal now. It's GR178 and GR179. And then that report is used for the multidisciplinary meeting, which discusses all the patients in the WIMRA, their supportive care needs. So the nurse updates that MDM reports with information with referrals and any other relevant information that's happened prior to the meeting. And that nurse then sends out this list of UR numbers of the patients that are to be discussed at that fortnightly MDM meeting. So there's usually between 6 to 12 patients discussed at each meeting, and all of the different health professionals who come into that multidisciplinary meeting. So we've got all the allied health teams, we've got cancer resource nurses out at Warwick Mobile, and also with Neil, Eden Hope. They can access the patient's actual UR numbers and know what's happening for those patients. So the fortnightly teams meet, they discuss, they bring up the patient record up on the screen, and each patient is discussed, and clinicians can update whether they've seen the patient and how they're going. And that MDM report can be updated in real time with that information. So the actual clinicians who've been using it have found it to be a positive experience. They've said it's easy, it's easier to follow and understand what's happening for patients in the meetings, and also that it's improved patients' privacy and their data, and also involved them more in the patient's care. So, yeah, it's been helpful for them. They're at different places in different buildings, and those clinicians can get together and actually discuss the patient, and it's much more patient-centred. So we'd like to thank Catherine Olston, who's been the prime user of this. Catherine's an amazing cancer resource nurse, and also Nor, who's the business analyst with Opal. And if you've got any questions or want to contact us later, please reach out to Carmel or myself.
That's great. Thanks, Donna and Carmel. It's no mean feat to try and condense and synthesise what is a large piece of work into a very short presentation. So well done. That good mix of fantastic video and then the slides accompanying was really good. We'll open up to the floor, but I have just a question or a comment. 50 minutes per patient is an incredible time saving. Do you have, or would you consider collecting, do you get any anecdotal feedback from the consumers themselves around it? Because that's quite a different approach to sending them home with a form. Were they always sent home with a form, or was it sometimes ever, I guess, that, that the nurse sitting there with them filling out the form, or was it quite a different change for the consumer?
No, sometimes the nurse would sit there and fill it out while they were there, but because it did take a long time, and then she had to go back to her office and transcribe everything into the computer record, the EMR, and then onto another form. So that's where all the time saving really was. Yes, many of them did get sent home with them if they didn't have time, so only in for a short period of time, or they might have said, we'd like to do it at home, which is sometimes code for I really don't want to be bothered. But it's been much easier when Catherine can just sit with them and go through it. We're getting much better feedback. But no, we didn't actually ask them. Well, we didn't really have anyone that would have done both the paper and the post, so we chose not to do that.
Yeah, no, absolutely. And also, would it, I imagine, I increase the data accuracy as well, because you've only got it entered in a single point versus the risk of transcribing errors as well.
And the other thing is when clinicians, allied health team members and that cannot make the meeting, they can update the record with their notes so that we still know what they've been doing in the meantime.
Yeah, fantastic.
Yeah.
Are there questions or comments from the floor? Over what period of time was the project? Oh, sorry, did you want to go, Anna? No. Oh. How long was your implementation project? Over what period of time?
Well, it was 3 months pretty much, and we were improving the whole way. We'd load the forms and then trial, and Catherine would come back through and say, "Oh, this isn't working," and then ways of them presenting the any of the issues that patients were having, putting asterisks next to those that were requiring assistance, so we could actually flick through the multidisciplinary meeting quickly, and you could highlight, oh yes, that if an asterisk means yes, that patient is having trouble with toileting and continence, and so that means the meeting flows faster, so you can actually just address those points quickly.
Yeah, very good. That's great. Anna?
That looks fantastic, amazing to do that in 3 months and get that great change. I was just wondering, so it sounds like when they're entering the data, it's going straight into the system. Is that what you were saying? Yeah, okay. So it helps a lot with time, but reducing error potentially, and then and a lot of people are able to see that information all at once if they need to.
That's correct. Yes.
Yeah, that is fantastic. Well done. That's great.
Yeah.
You just need to do that across the hospital now.
Yeah, so that'll be the next thing, is working with the Day Oncology in Ballarat and Stawell to be doing the same thing. So that's what we're working on now. We already get many referrals from Baroque at Ballarat with the patients from our region who have treatment there. So we then, they send referrals and we contact them and do that work, because otherwise we may not see them. So, yeah.
The forms are all ready to go in Ballarat. Yep. They're sitting there waiting to be used. So
it's just about getting the process right there.
Yeah, well done. That's great.
Very good. Any other questions? Silent? Okay. Thanks, Carmel and Donna, again. Well done. That was really great to see. So as I mentioned earlier, we don't have our third presentation for today, so we're looking to reschedule Ali Monk's presentation for later in the symposium schedule, so for another time. So that means everyone's got some minutes back in their day. Just a reminder, and the links in the chat for the rest of the program, the presentation program over the next couple of weeks. So the sessions are all on lunchtime, and just a special mention that in Horsham next Thursday, we're doing an in-person watch party. So for those colleagues that are at the Horsham campus, it'd be great to see you in person and come along and have some snacks. But thanks again for joining us, and we'll see you all again next week. Thanks all.